Alois will be doing some slides, and then we'll also be assisted by Laura. Few housekeeping rules. If you're not speaking, please turn your mic off. And also the other good thing to do also is to switch off your videos. That will actually save you some data and your bandwidth as well. And so if you have any questions, please pop that up in the chat, and then we can kind of respond to that. But if there is any question that is related directly to any of the presentations, you'll be given time at the end of each session to kind of ask questions. Does anyone have any questions or comment before we go straight into the presentations?
Thank you, Dr. Ebol. I just want to get some information from our colleagues up at the Highlands. What's the case now of COVID-19 and how is the situation now going on up in Goroka, Mount Hagen, and all other places up there? Thank you.
Okay, thanks. I think probably I can just respond to that just to save us some time. Yeah, this Highlands provinces are kind of going into lockdown at the moment. The third wave is kind of hitting very hard in the Highlands. I think, that's what the situation is right now, but every province is kind of doing their best to, keep or contain the pandemic, but let's just watch and kind of support where we can. So with that, I think we'll go straight into our presentation, and I once again want to welcome everyone. So we can start with the designing public health intervention. I'll take you through these slides, and then we'll be joined by Alois in the next section. So next slide, please. Okay, so I think the slide basically gives us the different phases of the Advanced Field Epi Training Program from phase 1 to phase 5. So currently we are in phase 3 and planning for phase 4. Phase 4 is actually the intervention project phase. Next slide, please. So this slide presents the field epidemiology in action method. You have a field project, and then you have the intervention. So there's two bits of component. This slide was adopted from the presentation done in the Solomon Islands, but just showing you the field project. That's where you find out more information about the health problem. And then the second project looks at the intervention, designing an intervention to try and solve the health problem based on your field projects and knowledge. So the diagram shows the broad steps of intervention, and also the steps are provided to you on the screen, and that's very clear. So today we're going to look at the process of the different steps in designing an intervention for a public health problem. And in the first stage, you identified a health problem, formulated a health project question, and designed your project. So over the past 2 months, you've conducted your field project, analyzed and interpreted your data, and it has been exciting to all the projects that you've presented so far. So in the next slide, you are to be designing your intervention. So you'll be building on the results from your initial work that you've been presenting last week. Even though it is a different type of project, the approach you'll be using is quite similar. And if you can kind of think back of, your intermediate, especially for those who undertook the intermediate FET project, I think you can also remember that you did some interventions, and that should be clear. So I just want to take you through the definition for a public health intervention, just rephrasing or kind of reflecting back on what it was. It is an activity designed to prevent, manage, and control diseases, injuries, and other health conditions. And also it's an activity, I mean, the activities could include any of a broad range of public health measures. For example, promotion of healthy behaviors, surveillance of health events, vaccination programs, and support of healthy environments. So these are some examples of public health interventions, increasing vaccination coverage. So for example, those who have done some initial analysis of vaccination coverage like Diane, if you're planning to kind of do increase the vaccination coverage, that could be an example of a public health intervention. Then improving antenatal care and the number of supervised deliveries, raising treatment completion rates for tuberculosis, measures to decrease tobacco usage rates. All these are, very good examples of public health interventions. So I think there's a question for each one of the fellows. Has anyone been previously involved in a public health intervention? And I think for most of you, it could be a yes, because most of you have taken the intermediate project. But does anyone want to share with us, an example of an intervention that you have done besides your intermediate interventions, like training other healthcare workers to do something, or having meetings in our community to improve behaviors of health outcomes? Any volunteer want to share their experience at this stage about any interventions that you may have done? Make sure you unmute yourself if you're speaking. Sorry, I can't hear. Is anyone speaking? Okay. If you're not speaking, please mute yourself and switch your cameras off. So I think, in our daily lives, I think there's a lot of, issues that we kind of address. As clinicians, most of the times you just try to treat patients, but I think as public health and epidemiologists, we try to look at the problem in a more broader scope, and then kind of think about ways in which we can improve community health and community, healthy lifestyles. So I think we could actually, think of so many things in our work environments. Simple things like, if the reporting coverage, like in the current pandemic, we're seeing a lot of reports not coming in on time. So if we design, if we kind of identify what the issues are and try to address the barriers to improving reporting coverage, that's an intervention that we'll be kind of thinking or working towards. So it's that kind of thing that we normally do in our routine work, but we don't normally recognize it as a intervention. So I think if nobody's volunteering to kind of tell us what are the public health interventions that you've been involved in, I think, yeah, we could actually jump onto the next slide. So designing an intervention for your FET project, it's exciting and challenging features of the Advanced Field Epi Training Program. And then you may have already have some clear ideas for interventions, but important for you to consider all options and be guided by available evidence from your field project. You will likely have many potential options to choose from. So also you need to balance potential impact and constraints such as time and funding. So this slide is the learning outcomes from the interventions of the course. So addressing a public health problem and looking at the public health interventions. Through completing your intervention project, you should be able to form an evidence base, identify and design an appropriate public health intervention. You should be able to implement one or more interventions. You should also be able to develop indicators to monitor the impact of public health interventions and evaluate the public health intervention and develop appropriate recommendations for it. Am I going too fast, or is it okay? Okay, I'll stop there and then probably ask for any comments so far for the section we've covered.
Just wanted to jump in
Okay.
quickly, Abel. So
Yep.
everyone, all the advanced fellows have gone through the intermediate program, so they've all done some interventions. More recently, we've created a bit more of a structure around thinking through the intervention design, and that's what we'll be presenting to everyone today. It's kind of a bit of a stepwise process to really help you identify the problem from your first project, really, and then base your intervention on that problem. So it's an evidence-based intervention. So using your data as that slide that Abel showed, your data from your first project has got to be used to guide and shape and develop your intervention. So it's really important that you have that connection back to your data, back to your project when you're presenting your intervention to us. So what's coming is some teaching around that framework that you can use, and you have some practice on using that to help structure your intervention and think it through.
Thanks, James. We're still hearing having some background noise. I'm not too sure mic is still on, but if you can switch off your microphones if you're not speaking. All right, I think the next session will be led by Laura and Alois, so I can actually turn the floor back to them. Laura.
Hello, hi everybody. I'm not sure if I've met you before. I'll quickly turn on my video and say hello. So I think Alois is presenting this, but I'm not sure he's on the line. So I'll do a quick introduction. So my name is Laura McFarlane Berry. I am an epidemiologist and a veterinarian. And so I think I've met some of you before, but not as a whole group. So really a pleasure to meet you today. Alois, are you on the line? I think he's on mute. I think you're on mute. I'm going to stop my video and hopefully Alois will jump in. But we're going to run you through a scenario talking about, with the example of malaria. So using some examples with a malaria scenario, and then walking you through the steps of designing a malaria intervention. Alois, do you want to jump in? Okay, I might make a start, and then hopefully, Eloise, if you can unmute yourself when you're available, please do jump in and take over. I think just some background on malaria, and I think it's a disease that you're all very, very familiar with. So hopefully this isn't sort of something that you haven't seen before. So we here are some maps. They're from 2017 from the World Health Organization. There's something called a Chloroplast Map, which provides, we're looking at rates for populations. And so I'm interested, perhaps somebody can interpret these for me. Can someone tell me which areas of Papua New Guinea have the highest rates of vivax malaria? So can somebody jump in? Matthias, I can see that your microphone is...
Sundown?
Yes, yeah,
From Sundown? The
yes.
one in red, darker red?
Yes,
Those are the
darker
ones
red.
that, yeah.
Absolutely. So what kind of areas are these in PNG? Any of the areas you live in? Anybody on the line?
Coastal areas.
Yes, some coastal areas. Yeah, thanks.
Or maritime. Yeah.
The key will be, I give it to.
Waterlogged areas.
Yes, you need to get the key.
How about if we look at this map? Is the distribution similar or different to the other species of malaria?
Different.
Different, a little bit different. I mean, I think these areas are still high here, the similar areas, but then over in, I don't know if you can see my pointer actually, but over here, I think perhaps the number of confirmed cases is a little bit higher. So how about we go and interpret some graphs and call for volunteers here. So perhaps we're looking at testing and testing positivity rates. Can someone describe how the percentage of suspect cases tested has changed over time? Or does anybody want to have a go at interpreting the first graph here? So these are both sourced from WHO again. Anybody want to jump out, or I can call out names, maybe? And Eloise, if you come back online, please do unmute. So does somebody want to have a go at interpreting this first graph? Stanley?
I can give it.
Yeah?
I can give a try.
That would be great. I can't see who's speaking, but
I am Likas from Area Provincial Authority.
Perfect. Can you please have a go at interpreting the first graph?
Well, there were less suspected case tests from 2005 to 2012, but it picked up from there. And I think that's the time that we were picked up rolling the Mala 1 and Mala 2 were all suspected cases to be tested.
Fantastic. So I missed the last bit of that, but I think that was a fantastic description. Fewer suspect cases were tested from 2005 to 2011, and then it really picked up. Really well done. How about test positivity? Does anybody want to have a go at interpreting that second Lycus, would you like to have a go at interpreting the second one, or you'd like to try and find another volunteer?
I'll give, I will read information. Let me read first.
Okay, anybody else want to jump in? Stanley, maybe? Or-
Hello.
Yes, yes, Symphorium, yeah. Would you like to have a go at interpreting? Yes.
Okay. From the beginning, from 2005, the slide, the positivity rate, as you see from the graph, with the already the same pattern. So whether they do RDT or the slide, but they got a similar pattern in the positivity rate throughout the testing period.
Absolutely.
So there's no difference between like the pattern of the positivity between the slide as well as the RDTs.
Fantastic. So really well done. So there's a similar positivity rate between the slides and the rapid diagnostic test. It does look like one peaked in 2010 and one peaked in 2014, yeah. But you're right, it's very, very similar for both. So really well done, both of you for jumping in there. Just to summarize, so we have the annual blood examination rates are increasing. The number of, if we look, also, we have one more slide. So these I might just quickly summarize unless somebody wants to have a go. If you haven't spoken, would you like to jump in and have a go at interpreting these two graphs? Matthias, would you like to have a go?
Hello.
Hello. How are you?
Yeah, okay. No worries. I keep moving from one unmuting my phone to the graph, and now I'm going mute. So okay, let me have a look.
Yeah, have a look. Tell me what you think about these graphs.
There's been a steady increase of all positive cases from 2005 to 2017, and then as compared to the P5X.
Fantastic, really well done. So there's been a real increase, a small increase in Vivax, but quite a large increase in overall cases. What about the admissions and deaths? What's happening with the trend there?
We can see a big drop in the number of admission and deaths at the year.
Fantastic. So we're seeing a really steep decrease in the number of admissions and deaths. So we see that the annual blood rates are increasing, the cases are increasing, but admissions and deaths are decreasing. So you know, either we have, and remember from the previous slide, you know, if we're kind of seeing an increase in cases, we are seeing increase in testing rates. you know, so potentially it's not a real increase in cases here. If we're seeing declines in admissions and deaths, it could be because people aren't presenting as well to healthcare clinics. Great. So
Laura, sorry.
yes.
Hello.
Yes.
Just go back to the previous slide.
Yes, absolutely.
Yeah. Now, I just want to make additional comment here, like the admission and deaths have declined, maybe just connected to the previous with the introduction of the ACT, like they were able to do tests at the first level facility, like 8 posts, or to prevent like from mild malaria to severe cases. So with the introduction of ACT and Malawan available at almost all facilities, there's also have an impact of the admissions and deaths.
Fantastic. Thank you so much for jumping in, Bernie. That's really helpful to know. And I think we can see from the data, it's really that intervention has had a really marked impact on malaria admission and deaths in PNG. So here are some results, and this is what we're going to work through. The field activity results. So it's from a hypothetical, advanced fellow who's completed the first part of their training and have done a field project, and they've obtained this following results. So it's a place called Pandora. So don't quite know where that is. And we can see that there are, here are the results of this study. So I just thought very quickly, I don't want to take up too much time. We can have a go at interpreting these results. So we've looked at the whole of Papua New Guinea, and now we've looked at this particular location. So can somebody describe what's happening with the positivity rates by year at these clinics? Can someone have a go at interpreting graph number 1? What's happening to the overall number of tests? Is it going up or down?
The number of tests has gone up over going down, but the number of positive cases has gone up.
Fantastic. Great. Okay, if we look at the second graph, does somebody else want to have a go at interpreting what it means?
Are you there, Laura? I think you might have
Yes.
dropped off. Oh, sorry.
Oh,
you just
Oh,
went quiet
I just
for a
went
moment.
mute.
Maybe it's on my end though.
No, it's probably on my end. My internet's not amazing. Does somebody want to have a go at interpreting the second graph?
Yes, Stanley here, Elsie.
Oh, okay.
Yes. Hi, Elsie.
Factors of, hi. I think the
Yes.
factors affecting, the graph shows that the factors affecting the use of diagnostic test study facilities Pandora. I think the highest factor was availability of rapid diagnostic test that has affected the diagnostic test, followed by other factors. No training, yeah.
Yeah, fantastic. So the highest factor was highest factor impacting use of diagnostic tests was their availability.
Yes.
A use of
And then
diagnostic.
time consuming, yeah.
Yeah.
And the second factor was time consuming.
Mm-hmm.
And then followed by others. And then no reagent and no training.
Fantastic. Great. Well, thank you so much, Elsie. Do you think these results from this field study are similar or different to the national situation that we just looked at?
I think they are kind of similar.
Yeah. Kind of similar?
The national, you mean PNG?
Yeah, for PNG.
No, they are not similar. I think PNG, we have availability
Yeah.
of rapid diagnostic tests in all our facilities and even our lower level facilities.
Okay.
Elsie, if that's the case, like the test should be, I mean, it gives a picture of, there's only one district, but it may be the same as other district who also doing this, and they may have a similar problem of the availability of the test rise to like the amount of tests being done in the entire country. So not all provinces or districts are same. Accessibility is one. When we have diagnostic tests are being sent to provinces and districts that have better access, while others may have low access.
Yes,
They may not be able to have those districts that may be affected by the lower amount of diagnostic tests available at the facilities or district. Yeah.
Okay.
Great. So in the PNG example, I think we looked and we found kind of the test positivity rate and the number of suspect cases is increasing. But in this small study that a fellow has done, and we don't know where exactly they've done it, they've actually found the opposite. It's decreasing. So now you have an idea of what the scenario is. You have an idea of the context, the national context, and hopefully when it comes to your interventions, you also think of the national context, and then you also think of your specific field activity results as well. So we'll go into the steps of designing a public health intervention. I will jump back into the slideshow. Oh, and yes, yeah, terrific, Eloise. You can take over. I've just got to the steps of intervention planning.
I'm sorry, Laura. And everybody for inconvenience. I think it's a technology issue. I'm back on. Thank you.
Fantastic. Okay, I'll go back to moving the slides.
Thank you, Laura, for actually taking on the first part of it. And probably I'll just take on the next slides as we move on. Laura is going to be co-facilitating and she will assist in case anything happens. Thank you. The next part of the slide is going to be on designing a public health intervention, which is very, very important. And you can be able to see 6 questions that are posed here. This will actually be helping us to actually guide us through the steps of your intervention, planning steps of your intervention. So these steps just basically provides the general framework, but as you go through intervention, it very much depends on the public health problem that you will be actually doing intervention on. The application will be very much dependent on it. But let us continue to go through the presentations. And as you follow on, you should be able to fully understand and take on the steps that will be involved in your intervention planning. So let's move to the next slide. Yes. The first is what is the specific health problem that we need to address. So it is basically talking about the first health problem that we need to address. So as we go through the next slide, it is going to bring up a scenario that we need to discuss. In this case here, let's imagine that your study that you have done, or we have actually gone through, which is malaria and PNG. So the scenario here is, can we go back? Yeah, the scenario here is malaria infection and illness. So based on the field work and the results that is provided, probably we need to go through a brainstorm discussion here so that you can be able to sort of identify what are the specific public health problems that needs to be addressed. All of you have had some experience. You have actually gone through a lot of experience. So I just want you to be able to go through and let's have some brainstorm discussion. What are the main problems that is actually presented? So you put up the main problems here, let's brainstorm, and then we can be able to see what is the priority health problem that we need to be dealing with, especially in the case of malaria. So let's go through some brainstorm discussion right now. The question is, what is the specific public health problem related to malaria?
It's Laura
anybody
here,
wants to
and
jump in?
oh, it's just Laura here. I've put these graphs on the side just so you can remember what the field study was about. So we're looking at this field study in these 3 sites as an example.
So this can actually help you. Yeah, please go ahead.
Ben here. Okay. The main public health problem is malaria is still the biggest concern here, biggest public health challenge. Still with high positive cases, number of positive cases.
Yeah. Any more?
That's what the top graph there. Second graph is talking about the barriers to diagnostic tests. Okay, the main barrier is availability of rapid diagnostic tests. We are not making tests available at the facilities to enable them to, with the case management for malaria. So problem is main problem here is logistics or consumables for malaria testing.
Thank you, Benny. Any more fellows who wants to discuss anything else?
Thank you, Alois. Maggie here. Just in line with what Benny said, from the 2 graphs, as we can see, malaria continue to increase. We continue to see more cases of malaria. However, there's decline in the number of testings going on. So if that indicates that there may be more cases of malaria that are not identified, are not diagnosed due to low testing in that area. Thank you.
Thank you, Maggie. Anybody else?
Alois. For this facing public problem, factors affecting the use of diagnostic tests at that particular district.
Right. Yes, so there is an exhaustive list of problems. I mean, based on the experience, based on what we have actually gone through. Because of time, we need to thank you for those who actually contributed. That is step one. We'll continue to go on from all the problems that you have identified. If you really need to actually address the problem, apart from all this that you have discussed, what do you think should be the main problem that we need to be able to actually take on, so that you can actually kind of put interventions around the major problem that we need to deal with? Apart from all those that we have discussed, what do you think should be the specific public health problem? Any idea? You've actually done your studies. I mean, when you actually projected your result, like in like probably let's say you have done your studies, you have actually looked at a number of results. Apart from all the problems that has been presented, what should you think should be the the major problem, the most outstanding issue that you really like to probably start as a specific health problem, so that you can be able to put the interventions around it?
Almost about the enable that is affecting the use of diagnostic tool at the health facilities.
Right.
What did he say?
Lucas, there is a feedback.
Alois, from Lucas, Lucas, you there?
Yeah. Sorry, what? Can I repeat again?
Yeah.
I was saying the factors and the enablers that affects the use of the diagnostics, malaria diagnostic test kits available at the facilities.
There is a feedback somewhere there. Can somebody else be able to help Lucas put that statement? It's very important that we need to put that statement, because we will be looking at a problem pathway. So we need to work on that statement right through.
Alois, for here.
Yep.
I think the main issue here is the level of testing. Despite that the few tests are being conducted, we knowing the positivity rates of malaria, but the test actually, the number of tests that will be diagnostic test kits, we are not able to do a lot of testing to know the actual situation of malaria in this particular district. So it's when you see the second graph, the availability of rapid diagnostic tests. If we have adequate of those test kits, then we can be able to get a true picture, and then other interventions, whether it be treatment, that can come in. But the issue here is the availability of testing available in the districts. There's all the facilities have access. There's adequate test kits that we should know what malaria is like, having to have all those facilities doing testing of diagnostic testing kits. So that's the issue that we'll have to address here to know exactly what malaria situation is like in this particular district, so that other interventions can come in terms of bed net, anti-malarials, and so forth. Yeah, that's what I'm thinking.
Thank you, Lucas. Thank you, Simpuram. So let's all citizens.
Alois,
Yes.
Penny here. I just want to add on to what Mr. Sumun said.
Right.
Yeah, making availability of the test kits so that case management can be on spot once you get the result positive, and so that it will reduce transmission of malaria. We want to stop the transmission, cut that cycle off. And then it
Right.
will definitely reduce the positivity and number of cases.
Okay, so from all the brainstorms that we have done, we'll now use this as a specific public health problem that will be our intervention. So we will be able to use that as a specific public health problem, which is the availability of diagnostic tests impacting diagnostic test use and interpreting of the disease situation. So let's use that as a specific public health problem that we need to address. Is that correct for everybody? Are we happy? This is an interactive session, so I'd like all of you to be able to interact so that it helps us to be able to understand the steps in be able to put in place public health intervention. So I think all of us are happy. So this should be seen as a specific public health problem. Is that right? Everybody agree?
I always think we go to a step further. I don't know that information is available, but we talk about accessibility of diagnostic testing. Unavailability. But the access is a main key factor also that will affect the availability of the test kit. So we don't know where Pandora is, how access to the main supply point is. So that's also something that we can also
okay, let's look at both availability and accessibility. So that should be the specific public health problem. So once we identify this, it is going to help us to be able to, help us to be able to see the problem pathway, which is the next slide. If you're happy with this specific public health problem, we should be able to go to the next slide. Is everybody with us? I can actually hear Benedine.
Yes.
Doing a lot of contribution here. Sumun, Lakers. I'd like everybody else to follow through with us because this is very, very important. We're actually on the first step. What is the specific public health problem to be addressed? We've actually come down. I did a brainstorm of what the challenges that have been brought by malaria. And now we actually, from this brainstorm, we are not trying to be able to pick out what is the specific problem that we need to address. So the specific problem is availability, accessibility of diagnostic tests in impacting diagnostic test use and interpretation of the disease situation. So that should be a specific public health problem that we need to deal with. Let's move on to the next slide.
I lost one question.
Yes.
Can you go back to the slide? The public health problem here is long, long statement or there. We have to make it short and reality, something reality, in the country.
Okay, the key point is availability and accessibility of diagnostic tests in the use of diagnosing and interpreting malaria. Let's put it this way.
Yes, sometimes make it short so that we understand it. Understand the public health probably.
I think this is clear. Let's move on for the benefit of time.
Luis, I don't see there's a problem here. Whatever the statement is, we are.
Okay, we're still on what is causing the public health problem. There are two elements that we need to discuss to be able to understand the specific public health problem that we have just mentioned. The first one is to describe the problem pathway that results in a problem. We can be able to include many steps just to be able to get up to the problem. So let's look at a problem pathway, which is the next slide. Okay, this is a problem pathway. We start from a healthy person. We want to actually come up with a problem. What are the key problems that has actually been involved in actually coming up with a problem? So as we go through the pathway, let us discuss to be able to see what are the key factors. Let me just give a hint here. Probably from a healthy person, they may be, the problem with the source reduction. There is a lot of Anopheles mosquito operating in an area. And then you have not screened your household. So these are the kind of discussions that we really need to actually be engaged in to actually come up with a problem. So let's actually go through and see what are the specific problem discussions that we need to actually look into. So if you actually look at this slide here, there are two areas that we need to look into. One is the malaria cycle. If you actually look at the malaria cycle, you will actually see how the malaria has been transmitted, from the source to the susceptible host. So first of all, let's look at the malaria cycle. Then we can be able to look at a problem pathway. Is this clear to everybody? Laura, you can chime in at any time if you
Yeah, absolutely. So I can have a go with the malaria cycle if you want to have a go with the pathway.
Let's ask our fellows to actually, just help us to be able to just put a pathway for the benefit of the learning.
Yeah, absolutely.
Because once they go through this one, it's going to help them to be able to understand the problem pathway. Anybody willing to jump in and, to the first part of it?
Where do mosquitoes come from? Does anybody know?
Well, really, it's really from unhygienic environment where there is conducive breeding ground.
Yeah, absolutely. Okay, so we have a breeding ground.
Grounds for the mosquitoes to breed, and then they, infecting the. Yeah.
Yep. So we have the breeding ground. Then what happens? We have some mosquitoes.
And then the mosquito breed, they multiply.
Yes. Yep, they multiply.
They start infecting, carrying the malaria parasites and infecting individuals or people.
Great.
And then from.
So hang on, they bred, they've multiplied. How do they get infected in the first place?
Hi, Laura, Benny here.
Yeah, hi, Benny.
Yeah.
Okay, thank you. With malaria transmission and prevention, there are two cycles. One cycle is the mosquito cycle, and the other one is the cycle in the human. So,
absolutely.
It must start with the infected person.
Yes.
Bitten by a mosquito.
Yes.
Then the mosquito has to the parasite has to develop itself within the
Absolutely.
Because it becomes, when it's become mature and potent to transmit, that it will affect, it will, once it's matured, the parasite waits, the potency to infect or cause a person to become ill. Then when the mosquito transmit that states of that parasite to that other person, then it goes into the liver and gets developed there and then multiplies, and then the person becomes ill. So especially with malaria, there are two cycles of, we are looking at two cycles. One is the parasite itself, and the second one is the human, the host.
Absolutely.
So our intervention should, I mean, for breeding grounds and mosquito in these areas, it's really hard for us to, destroy all the breeding grounds. So we target the human host to reduce to break off the chain of transmission. But basic things is make sure that keep the environment clean and not to create environment opportunity for to allow the mosquitoes to breed.
Fantastic. Thank you so much, Bernie. So I was making the cycle as you were talking. So I think we
Okay,
did the first half and then you
from the
jumped in and we did the second. Sorry, Alois?
Yeah, no, that's okay. Now you can be able to see the cycle. So that's the first part of it. From the breeding ground, which goes to the malaria cycle, to the human cycle, and then eventually end up, you end up in a clinic or not end up in a clinic. So that's the first cycle. Is that clear? Is that clear to everybody?
Alois,
Yes. Yep.
Okay. The problem, we have identified a problem that there is inaccessibility. Access to the availability of test kits is the problem. So though we know the life cycle of malaria and how malaria is transmitted and so forth, but it's actually at the point where someone is being, they have malaria and we really don't know how many people are affected by malaria. And that is only been done by doing tests. So, but then we don't have enough tests. So that's the problem. We don't have enough test kits to test everyone. So only we do enough tests, a lot of tests, spread out how big the problem of malaria is. So that's the problem is the availability of test kits, diagnostic test kits at the health facilities.
Yes, thank you, Mr. Suman. This is just basically to help you to be able to guide, from the source to disaster, from the source to the susceptible host, just to be able to identify that, this is how the cycle that goes through to actually, transmit malaria to a human host. So, like Mr. Suman has actually said, the problem here is availability and accessibility to malaria tests. So as we put through this cycle here, the next part that we need to actually look into it is, what is the problem pathway? So it should be able to help us be able to put through the problem pathway. So it takes us to the next step, which is the problem pathway. You have actually identified the cause of the problem, but now let's go through the problem pathway and see what do we need to be able to address. So this cycle is complete. Let's look at the next part of it, which is the problem pathway. So anybody who's got any suggestion? We have a healthy person there. So like Simborim has actually said, what should be the next problem?
Alois, can I jump in?
Yeah.
Okay, good. looking at the accessibility, sorry, it's me, Bauri, from Western Province.
Yes, thank you.
Looking at accessibility and availability, I will look at it from the national level, also at the provincial level, down to the district and the community level. Okay, so my province, I think, is supported by REM. I'm not sure if other provinces are also supported by REM in the in providing the RDT kits from the national to the sub-national level. So that's where I'll be looking at the availability at the provincial level. And the other challenge to the availability is the accessibility. For me now, is the challenge from my province to the district or down to the community or facility level, whether it's the availability or the accessibility again. So I think it's a whole cascading issue of the availability and accessibility down to the facility level. Thank you. Over.
Thank you. Lucas.
Yeah, I agree with Dr. Madhuswari. We have a public intervention, and we have a public health problem there. Availability and accessibility, not the number of cases where we have to solve. That's why we have to be in line with our problem, and I agree with that, Dr. Paul. And in this case, can it match with the public health problem there, which is the availability, accessibility?
Okay, Matthias Bauer has actually provided a hint. Our problem now is the availability and accessibility. So what are actual issues that are involved in actually, that is actually causing the problem of accessibility and availability? Can we actually list some of the problems here? Anybody's got any regarding the accessibility?
Like the RD test kits are not available in the EMS.
So RDT test kits are not available.
Yes.
In the country.
Yeah, I think it comes a bit late, or low in stock, or like that. Comes to the provincial level less, I think, or sometimes none at all.
Okay. Laura's got anything else to say?
Yeah, I think we've probably jumped ahead just a little bit. And maybe we just need to work out what the problem pathway is,
Yes.
and then we can chat about some of the factors that may contribute. So I think everybody's really excited to talk about some of the factors that may contribute. But maybe if we just jump in and fill this pathway in. Can you hear me okay?
Yeah.
Yeah. It looks like my PowerPoint has completely frozen, so I cannot type anything. The modern technology. But maybe it's really good, I think, in the problem pathway to think about what the problem is, or what the healthy alternative is. So in this case, oh, there we go. It's working again. I think, we can either talk about where we hope to end up, which is here, or we can talk about, potentially, I think, it was Bernie that mentioned before, there's some people, maybe don't present to the clinic. And that they present and they don't get a diagnostic test. So let's perhaps think about this problem pathway and then jump in to consider the factors that contribute to the problem, which is the second part of this question. We can either start with where we're trying to end up, or we can go through sequentially, but it's sometimes easier to think about, what the destination is. So if we're thinking about a healthy person, and we've already worked out there is a problem with use of diagnostic tests and people not being diagnosed, basically. And the issue, I think Bernie mentioned that, if people are not being diagnosed, that they're a source of infection for others. But, alternatively, if people do present to the clinic and they are diagnosed, then they can be confirmed cases, and that's what we ideally want. So at the end of this problem pathway, we can include either of those. We can list what we hope in an ideal world, or we can describe what is happening now and what the problem is. So does anyone want to have a go at choosing what this last box is in this problem pathway? Alternatively, we can start from the start. So we have a healthy person, and I think
Rachel,
Benny, yeah, go on.
Which last box? Laura, sorry, which last box?
Can you see on the screen? There's a hopefully you can see. There is a series of boxes with arrows in a problem pathway.
Okay. From a healthy person, that person is, the next box would be
yes,
a person contracting malaria.
Yes. How do they contract malaria?
Malaria.
Yeah. How do they contract malaria?
It's been bitten by infected, mosquitoes.
Yeah, great.
Mosquito.
Infected mosquito.
Yeah, by an infected mosquito and contract malaria. Great. Okay, what's next?
Malaria. And then comes the health-seeking behavior, whether that person is being actually sick.
Yes, they're being actually sick. So they develop some clinical disease. Great.
And then after that, it's whether
yes, health-seeking behavior
comes in, whether they go for, so it's a health-seeking behavior comes in.
Yeah. So they, health-seeking behavior, they might visit a clinic. Okay, and what happens next?
Get tested.
They get tested. Terrific.
Get tested.
Okay, and then what happens?
And then if confirmed for malaria, they are treated.
Yes. So they could be diagnosed and a confirmed case.
Confirmed malaria case.
Yeah. And then you want to add an extra box that's treated.
Yeah, progress into treatment. If not treated, or whether they recover, and then it's too complicated, they might die.
Treated, we can
Recovered.
say treated and recover, or they could die.
Or complicated and die.
To develop complication and then
Terrific. Great. Okay, so we have a problem pathway. We've gone from the healthy person and we've gone right through to a confirmed case, and then that confirmed case being treated. And I think our problem actually probably is around this point. So I think our data didn't really look at the confirmed cases, but it looks at the testing. But we have this problem pathway now, which is really exciting. Alois, if you want to jump in, I think people already started talking about the factors that might be contributing to this problem. So I wrote some down. I'm going to type them in, but I think let's go to the next part of the question, and I think that was the factors. Alois, you there?
Laura. Yep. Thank you,
Yeah.
Laura. Thank you, everybody. We have actually looked at a specific problems related to malaria. But now we need to actually look at considering a broad range of factors that might as well contribute to the problem. Like we have malaria problem, we have all the issues that we have discussed, which is within the system. But in any problems, it is not confined to the system, but we need to also look at other factors that may be contributing to the problem. So to be able to give us a broader view, broader understanding of the specific problem, we should also look outside and look at other issues as well. So let's go to the next slide, and that should be able to help us look at the other range of the problem. So still on what is causing the specific health problem. Apart from what we have just gone through, if you actually look at this model is actually talking about, it is basically talking about the social determinants of the health problem, social determinants. This look at factors like individual or biological behavioral factors. What is actually happening within the communities that can also influence, the increase in transmission of malaria. Health systems, if we actually look at the health systems, is it a management issue, like some of those that we have discussed? Probably funding, supplies are not coming in the way we want. One of the most problematic issue that we continue to discuss, funding, or probably political and other social factors. If you really want to make sense of the specific problems, we really need to broadly look at it and look at the social determinants of health. These are some of the areas that we need to actually look into. And then the environmental factor. Those are other contributing factors that actually lead to the specific problems that we have discussed. Is that clear? Let's looking at developing a public health intervention, specific problems, other social determinants that we have actually looked into. Like we have said, is when we actually put in place a problem pathway, these are the problem pathways. Okay, these are problem pathways. Okay, list some of the contributing factors. And then what are the potential interventions?
So I might jump in here and just write it's Laura again. I might just write down what everybody said before about, I think I didn't write down who said it, but a problem with source reduction and that don't have enough kits for everybody. So I'll write those in now.
Alois.
Yeah.
Alois, can you hear me?
Yeah.
Barry here. I'm on mute and also no video because I'm working on my desktop, but also listen to it. Just want to make a small input, but I think it should be a significant one in any program evaluation or when we want to assess or even do interventions and discuss about these pathways of how I want to assess a system to maybe determine where the problems are and to able to try to solve some of those issues. You must first understand the policies of the department, and that also come down to the program itself. What is the policy of the malaria program? Okay, when we're talking about kits, test kits, what is the policy? Is it supposed to be available at every health facility, treated before malaria treatment given after the test positive? So you must first consider the policy of in that whatever program you're trying to assess. So as trainees and as also public health professionals, the policy of the government, policy of the department, the strategy is something that you need to look at first. If the malaria program says you need to, if they have symptoms, people with symptoms come with malaria-like symptoms, test first before give treatment, then that's a policy. That means that test kits must be available and used. And then if it is not available, then you look at why it's not available. So I'm just making input on policy of the policy perspective.
Thank you, Barry. Anybody else wants to step in here? What are some of the contributing factors? If you really want to put in place a public health intervention. So this is very, very important. We've actually looked at a problem. Now we're actually discussing what is causing the problem. All right, apart from what Barry said, the policy issues. What are the possible potential interventions? Or you may like to also suggest other contributing factors as well.
Alois here. Yeah. Contributing factors. Okay, one big question is, are they reporting and submitting their request or not? Reporting. If you are not reporting and putting in your requisition for consumables, then you expect nothing.
Okay, staff not reporting. What should be the possible intervention?
Maybe if we stick to step 2, is there any other contributing factors that are causing people to be confirmed cases of malaria that is impacting the public health problem, which is the availability of diagnostic tests and so interpretation of the disease situation? Any other contributing factors?
Hello, Roslyn here.
Yes.
This is in regards to the distribution of RDTs. For us in the province, it's Rotary Against Malaria that do this. So there's also a delay in distributing these logistics or commodities to the health facilities. So this is being done by REM, Rotary Against Malaria. So they are the ones who distribute these RDTs to the provinces and then down to the facilities. So there's also a delay in distributing of these RDTs as well.
Great. Issues with distribution of rapid diagnostic tests as well. Does anybody else have any ideas for problems that are contributing to the malaria situation in this example? Remember, it's hypothetical.
Alus,
Yes.
the lack of knowledge is another thing. See, RDT test kit was rolled out 7 years ago, and somebody had to be trained to use the RDT test kit too, and it ended up the result to treat the patient.
Yeah. Anybody else got any thing that you want to add on to the list of contributing factors for the sake of time, so that we can actually look at possible potentials for intervention?
Shall I jump back to the interventions?
I think let's move on to the interventions. Okay, we have actually looked at possible causes. We've got a problem, possible causes, but the third step, the steps that we need to put in place for intervention is what interventions could possibly work. In order for you to be able to identify those interventions, one is to actually look at your own research project and probably clinical insights. All of you have been doing clinical, you have been in the field, so you can use all these experiences, all these insights. The others that you probably like to look at it is your own interventions. Some of you have actually done your intermediate training, you have done interventions. So this should be able to give you some insights for you to be able to consider your possible interventions. The other issues that you need to look into, your stakeholders. Maybe your stakeholders, maybe the community members, other people who also, when you're actually in the process of discussion, they should be able to highlight some of the issues that you need to take on. So there are different sources that you need to actually look into. The first one we've discussed, your own research, clinical insights. And then your discussions with other stakeholders, members of the communities, probably others would like to come in. Or you should like to look at a review of existing evidence of your health information system. You'd like to do a literature review. So all this should be able to help you to put in place possible intervention. So let's look at some possible interventions here. Anybody like to suggest anything here? We have listed contributing factors here.
So for the first contributing factor, that there's an issue with the source reduction, what are some possible interventions for that to address that issue? Any ideas?
Sorry.
Yeah.
Roslyn, with the source reduction, we are really looking at this is to do with people in the community. So we can maybe conduct awareness or talk to the people in the village on health, hygiene and all this, so they can, because usually it's source reduction is mainly where people live in the village or in the community. So we can conduct awareness about prevention of this and source reduction as well.
Yeah. Anything else? That's a source reduction. Anything else regarding source reduction? Or do you want to jump onto, you do not have enough kits for everyone? So what do you do?
Alois Manus.
Yep, David.
There are several interventions. The current one that we are doing it now is the mosquito net distribution.
That's it. Mosquito net. I want to say it.
And the other one is if possible, we can introduce back the fogging machine, the spraying activity.
Okay.
That one is a good one for the community.
Right. Anything else?
Alois is Diane.
Alois, Benny here. Oh, sorry.
Okay, Diane and then Benny.
Diane, go first.
All right, thank you. I was thinking more into training the healthcare workers on the signs and symptoms of malaria so they don't misuse the RDTs on other like problems or complaints.
Yes, some of them have been in the field for quite a while, so knowledge may be outdated, so requires some bit of training. Yep. Benny?
Thank you. When looking at interventions, we must also consider the factors like time. Do you have the funding to roll out the intervention? Like for fogging machine, this will, it's costly. So with this case scenario here, back to basics, primary health care, awareness in the community, advise community, make sure that the environment is clean, manage their domestic waste properly, basic things, their homes, windows, every time they wake up, windows open, sleep under treated mosquito nets. So these are like basic primary prevention that we should focus on. So health education and awareness should be our priority.
Yeah, thank you, Benny. That's a very good contribution.
And
so,
second
continue.
one is our intervention is to target the host now, the human patient. When sick, sleep under mosquito net, like we've already mentioned. And concern is not enough test kit, the second contributing factor. So with just another intervention is to check, look at the monitoring and stock system. Where is the problem and try to address that so that stock issues or supplies must be made available at the facility. So look where the actual problem is and RDTs are not made available at the facility. Even if they have the RDTs at the province, what's the problem that those test kits are not available in the health facility? Is it transport or logistical issues to ship the test kits to the facility? What is it? Or is it training that even though tests are available and staffs are not trained? So look at that, like what Diane mentioned about training of healthcare workers. Now with malaria, go back to what Mr. Roper mentioned. With malaria, it must be evidence-based. We're trying to limit as much as possible for clinical diagnosis and case management. And a lot of emphasis is on evidence-based, meaning diagnostic by RDT or microscopy, examination to get confirmed case. A lot of clinical assessment has contributed to a lot of high number of malaria cases, with some may be true, some are not true, just that because of clinical diagnosis that we have a lot of reported like malaria cases have increased. But with the new treatment protocol and by policy, evidence-based, and it has to be RDT or microscopy if you have access to laboratory. And we try to limit clinical diagnosis when there is no option for RDT. When you run out of RDT, that's when you use clinical diagnosis comes in. So, and officers must be trained to identify or clinically diagnose malaria cases well. Thank you.
Thank you, Benny, for these contributions. We have actually looked at a problem pathway, listed the contributing factors. These are the possible interventions that we have actually looked into. So start from the problem, causes of the problem. What are the possible interventions? So we have gone through that step. I think it's very clear we have gone through. For the sake of time, Laura, if you got anything to add on before we can actually move into the next slide.
No, I don't. I thought that was very, very comprehensive. So really well done to everybody who contributed.
Yeah, thank you. Thank you for these contributions. I think you really need to understand all these things if you want to actually go out there and put in place your interventions. The next step, which is the steps of planning intervention, which is what would be fair. Some important considerations could be fairness and equity. When you actually go out there, if you want to address a problem, you can actually look at some people are living in the most isolated and remote areas. Some cannot be able to afford. So to make up, fair kind of intervention, you should consider all these factors. They are disadvantaged groups that are, affected by the problem. So you actually look at so that, provide equity and fairness. So that it helps you to be able to put in place the available interventions here. Looking at the cost factor, all these things, we will be able to discuss the barriers at the end of it. For instance, looking at netting at the resort beach rather than nearby villages. If you want to put a netting at the resort beach, is it fair? Does it help everybody? Or you look at the nearby villages. So these are the considerations that you need to put in place. So that's basically what it's talking about being fair. So that, with whatever that you have, you should be able to equally distribute it right across to everybody who has been affected with a problem. Next slide. Okay, the next intervention step is what would have the greatest impact. This pyramid should be able to help us to be able to look at what impacts that we can be able to do. So if you look at this pyramid, as we actually look at the pyramid, it's talking about increasing population impact. And from the pyramid down there up is talking about increasing individual effort. So individuals have to make an effort so that there is an impact in the population. As we go through this pyramid, we go through step by step, it should be able to make it clear to all of us. So let's look at the next slide and probably start from the bottom. Looking at the pyramid, what is at the bottom is socio-economic factors. Socio-economic factors include safe water, better nutrition, better housing, safe environment, better education and employment or income. If you can be able to look at some of these factors actually, contribute to the specific problems that we're actually talking about. So we as health workers should actually look into this so that once this is balanced, we can be able to make a lot of impact. So there are, exhausted list that we can be able to go through. But in terms of socioeconomic factors, these are some of the examples that we need to actually look into. Next slide. The next half of the pyramid is changing the context to make people make healthy decisions. Example, adding iodine to salt, removing lead from the petrol, banning smoking in public places, make healthy food more readily available. If you actually look at, around us now, most people actually having problems with, non-communicable diseases, accessing processed foods. So people have to make a choice between whether they want to go for, organic foods or they want to go for processed foods. So, help people to be able to make decisions, make choices. So we need to be able to guide them right through. Next slide. Which is the third level up the pyramid, which is long-lasting protective interventions. One-time or infrequent interventions. Immunization for communicable diseases. Examples, community treatment with azithromycin to decrease JOS prevalence. Whether male circumcision decreases HIV transmission by 60%. So these are some of the long-lasting examples of some of the long-lasting protective interventions that we need to actually put in place. Clinical interventions, limited by access, adherence, effectiveness. These are very, very important, accessibility issues, whether you are living in a remote location or most isolated location, or probably the road network is not good enough. Adherence. Are people complying to treatment? Are they actually listening to advice when you actually take the risk communication messages, health messages, or is it about effectiveness? Probably there is an abuse of the use of antibiotics. People selling drugs on the street. So when you actually try to put in place a program in terms of effectiveness or adherence, for instance, TB dose program for TB, probably you end up with multi-drug resistant TB. ART therapy for people with HIV infection. Due to stigma and all this, are they actually complying or are they having access? Intravenous rehydration for severe cholera. Chronic medical therapy for hypertension and high cholesterol prevents heart diseases. So these are some of the clinical interventions, probably limited by access, adherence, effectiveness. So we need to actually take some of these issues on board as we are discussing interventions. Thank you. So let's move on to the top of the pyramid, which is counseling, education, intervention, where the majority of the public health interventions are found, but often leads to effective and most labor-intensive aspect of the pyramid. This often requires significant behavior change or may require choosing healthy alternatives in a climate where unhealthy defaults are the norm. For instance, smoking cessation, which is very, very difficult. Weight loss counseling, all these factors, which is leading to, ongoing problems back in the communities. Let's look at the next part of it. Interventions at multiple levels likely to be effective, but may be more costly. So cost factor needs to be looked into this one. Example, reducing tobacco use. if you actually, put taxes on cigarettes, restriction of sales, smoking banned in public places, clinical support for those who quit, these are some of the measures that we need to consider if we really want to reduce, what is actually leading to factors that is related to smoking. We have actually looked at developing a public intervention. So looking at this pyramid, potential interventions that you'd like to put in place, where does your intervention fit in? Does it fit at the top, or probably the clinical interventions, or is it somewhere there? So you have to exactly know where your interventions are actually coming in. So like we have actually discussed, potential interventions we have discussed is over the right side of your pyramid. So you alone will decide where your interventions actually come in. Laura, you want to add anything here before we actually move on?
Yeah, absolutely. So can somebody tell me if we're looking at conducting awareness, where would that fit into this pyramid? Which level between the bottom one of socioeconomic factors and the top one of counseling and education? Where do you think the awareness fits in?
Changing the context to make individual stakeholders healthy?
It could be, yeah.
Awareness
Yes.
will come at the bottom one.
Awareness is the socioeconomic factors?
Yeah.
I agree.
Anyone else? So when we're conducting awareness, yeah. So when, absolutely. So when we're talking about awareness raising, is often speaking with people and educating them about the practices. So I'm guessing it's going to be right at the top of the pyramid. It's it's individuals who need to change their own practices. So you need a lot of individual effort, and you need to go around to all different people to educate them. How about, does someone want to give another example? What about, say, mosquito net distribution? Where do you think that fits in?
Lord, Benny, here it comes
Yes.
under the long-lasting protective interventions, the LM,
Yeah.
mosquito net, yeah.
Yeah, I think a mosquito net definitely could be a long-lasting protective intervention. It's probably a bit of both, because you've got to persuade people to sleep under it as well. So that, yeah, but definitely I think potentially a mosquito net can be something that is long-term. It's definitely not a clinical intervention. Fantastic. Well, in the interest of time, we won't go through them all, but it's important when we look at the public health interventions to think about, how much effort is needed, where are we targeting the messaging. And I think for the interventions that you do, often it will be at the top of the pyramid. So looking at socioeconomic factors and trying to address those is a very big problem, and probably something that many people need to address across many different government departments all working together. It's a long-term thing. So with your interventions, they'll probably be more at the top of the pyramid, and so requiring more individual effort, but that's okay. just something to be aware of.
Okay, let's move to the second last part of the step. That is the last part of the step, but I think we'll just cover the barriers that should be able to get us to the end of this part of it. So what can actually be done? So always relevant to relevant, but particularly for aFETP fellows. You have a very limited time to actually do your intervention. So the key areas to consider is within the time frame that is given. You should actually look at cost and other resources that are needed. If you actually put in place a very costly intervention, will you be able to implement or put in place what you've actually decided to put in place? So those are the issues that which needs to be looked into. Probably other technical issues, probably you don't really have the expertise to actually look into this. So when you actually look at intervention, put in place these factors, look into these factors, time that is available. Do you have the time? These are the actual considerations. Do you have the influence? Is it within your scope? And the power to actually implement. So if you want to put in place your intervention, these are some of the areas that you need to look into. Because of time factor, we cannot be able to go on, through a lot. We cannot discuss a lot, but these are some of the guides that should be able to help you. So when you're talking about putting in place your intervention, these are the factors that you need to actually look into. Is that clear to everybody? If that is clear, let's look at the last part of the slide, possible barriers for intervention. Like we have discussed, cost may be a problem, time and logistics, or there may be cultural barriers. Like in the case of COVID-19 that we actually going through, vaccine hesitancy. Lots of things coming on the social media, but I'm just, making this point, just to be able to, for you to understand the context. Probably political barriers, or you're putting in place an intervention. Probably you have never actually understood the intervention that you need to put in through. Maybe have been too ambitious. So when you try to be able to intervene, you begin to see that you are not able to do the intervention. So this may be a possible barrier. Or stubborn adherence to unhealthy behavior, people's attitude. Probably you tell them, this leads to non-communicable diseases. People don't understand. They don't really believe in what you're saying. So they continue to, live by these unhealthy practices. So that continues to lead to problems. So prior to you putting intervention, you need to actually look at these barriers. So if you don't actually look at these barriers, it would really not help you to actually put in place your intervention. So before you actually design interventions, we have gone through the steps, 6 steps that we have actually looked through. These are some of the best possible barriers where it may not help you to be able to successfully put in place your interventions. So this actually brings us to the end of this part of the slide before we actually move on. Anybody has got any comments, any views? Laura, you want to jump in and say something before we can actually conclude this part of the presentation? Thank you.
Nothing from me, but just the 6 steps are up on the screen. And the next part of the activity is that you'll get a chance to work through this together. So I'm really excited to see what you come up with for an intervention.
Okay, that's really.
Thank you, Paul. I think that brings us to the end of this part, so you can jump in now, Paul.
Yeah, thanks. Sorry, Rachel.
Oh, sorry, it's Laura.
Laura?
I was going to say, should we have a small rest break before the next part? It's up to you.
Yes, yes. We got to have probably about 5 to 10 minutes break, and then we'll actually have another hour session on a case study. So at this time, I just want to check whether any of the fellows have any questions for Laura and Alois. If not, yeah, it was a great presentation and facilitation, Alois and Laura, very much appreciated. So thanks again.